Hello, runners, and welcome to our HSS Coaches Chat. My name is Coach Annick Lamar, and I am joined by the Hospital for Special Surgery's Dr. Karen Sutton. So welcome, Karen.
Thank you very much for having me.
Yeah, we are thrilled to have you here. We have a fantastic week at New York Roadrunners. It is the Mastercard New York Mini 10K week for us. This is the 50th running of this mini race, which is our 10K distance. It is a historically women's race, and we are delighted to celebrate 50 years of it. But that means we have a focus on women's health, which is why we have Karen here today, who's going to talk to us about all things women's health and running. Now, runners, this Coaches Chat is for you. And as always, we advocate, encourage, and are delighted when you tell us where you're listening from, or you have any questions that you want to ask either myself, a coach, or you want to ask Karen. So let's hop right into it, and we'll get to your shout outs, your questions and comments throughout the chat. But Karen, let's talk a little bit about what it is you do at the Hospital for Special Surgery. And let's start there.
Sure. I'm a sports medicine surgeon, so therefore I see all types of sports injuries, and it ranges from youth athletes to our senior Olympians. I see across the board from head to toe lots of different issues, whether it's prevention or actually injuries as they come up. And I try to keep athletes out there and being healthy and active for as long as they can be.
I love it. Yeah, Karen, you're the right person for us to talk to today, obviously, because you're talking both about prevention and then sort of what happens when maybe issues arise. And with our runners, we always love to talk about, we call it, prehab, like the preventative steps they can take. And then also how to get help and how to take care of themselves as runners, because we know if you're an athlete, having an injury is just going to be maybe a reality of your experience, and you have to normalize that and seek treatment. And so one of the things I'd love to talk to kick off the chat is this idea of strength work. Can you talk a little bit about, this is maybe the question, one of the top 5 questions we get as coaches, the role of strength work for women athletes, potentially from a preventative injury standpoint, but also just what it can do to help with running and how to improve their running overall.
Sure. I think that one misperception or just a challenge that runners have is they just want to go out and keep running. Just move their bodies, get out there and run for as fast as you can, as long as you can. The problem is if we do that, then we're setting up ourselves for injury. I think there are a few key muscle groups to really focus on if we're talking about strength and conditioning, getting ready for any type of running event, and it's to really stay strong in our core. The emphasis would be on your abs, from the obliques to your rectus muscles, so the inner ones and the outer ones. Also, when you think of core, I also think of your glute muscles, your gluteus medius, gluteus maximus, your buttocks muscles basically are the strongest ones in your body and the largest ones in your body. So they can give you a lot of power, but they can also keep you healthy as you run.
Yeah, no, I mean, this is one of those things that running is one of those things that we tend to think of our waist down as doing the motion, and the core is completely lost to many of us in our minds. We're like, well, my arms don't do anything and my core doesn't do anything. Therefore, my strength work, I don't need to do anything. And the reality is the core is, a huge place of foundational strength. And without a strong core, everything starts to, energy leaks, you have a lot of issues that can arise down chain from it. So I think the core is so important. Do you have any strength exercises that you either personally like, or that you sort of, suggest to athletes as they're trying to get just stronger for their running?
In terms of suggesting for athletes, I think one thing that really helps as you're getting athletes prepared is to just start as simply with just planks. If you can, we're all running around, especially, in the New York area, we kind of run at a mile per minute, both when we're actually running as well as we're running our lives. And so I think if you can just do planks, maybe as part of your brushing your teeth, you're getting ready for work, just try to do maybe a plank for a minute a day and see if you can keep increasing the length of your plank. That starts to engage the core. The other thing, if I were to suggest something else, is to work on squats. And it can just be as simple as a wall squat, just putting your back up against the wall and getting down to where you're in a 90-90 position with your hips at 90 degrees and your knees at 90 degrees and really engaging the glutes that way. I like to keep it simple. I think that the days where we have to lift a ton of weights, including barbells and dumbbells at an excessive amount of pounds, it's not necessary. And I think it could actually be detrimental if you're doing that too much. So I would say try to keep it simple, focus on really easy exercises that don't bother your body, from the planks and the squats. And then if you want to get more involved, and certainly I think it's helpful to do any type of crunches activities. Yoga is actually really helpful too if we're thinking about the flexibility side.
Yeah, I love that too because we've all got walls, we've all got floors, but we don't all necessarily have access to a barbell or a gym or a trainer to help with like an Olympic weight movement. And so really starting that foundation of just saying, okay, you know what, I can get down, I can plank for 30 seconds, and from there I can build up, or I can go to the wall and do a squat and hold it for 30 seconds, rest for a few, stand up, walk around, come back and do it again. It's one of those things that you can integrate into your running routine, which is why I just think it's such a valuable way to look at strength. I always love talking about strength, especially about women's health, because I think women are strength work is de-emphasized for women because there's this misconception that we think that we're going to bulk up, and this is against the counter of how quote unquote women should quote unquote look. A lot of quotes going on here, but it's I wish that we could bulk up as quick as that is possible. Like I'd love to go lift like a 10-pound weight a couple times a week and then all of a sudden be jacked. But that's just not how muscles work. And so I think it's just important to normalize for women runners, like go work out. And if you got jacked, that'd be the best thing that could happen. But the reality is you'll just look stronger. You'll be stronger. You might not look as jacked as you think you are. I don't know if you come across athletes who have that misconception about strength work and the impact it'll have.
I think in general, for any athlete, it's you see the appearance of your body and you think it's going to change based on what you do. But that happens more with patterns and more with just routines over time. I think the key to a lot of this is just what can you incorporate into your routine? It's the same as if you were to talk about nutrition and you have a dietitian who completely revamps what you're doing and it doesn't fit into your life, and maybe you lose 10 pounds over 8 weeks, but that may not be realistic. And so it's the same with this, where if you start a strength program and it just doesn't fit into your lifestyle, if they're like, for 45 minutes a day, 7 days a week, you have to do all of this, it just may not work. So I think it's a combination between what fits into your busy life, whether you're a student, whether you're a mom of 4 kids, whether you're a grandmother and trying to, help take care of the grandkids, or working full time. Our lives are so busy that I think if you can incorporate 30 minutes to start 3 days a week and then build up from there, it's really critical.
Yeah, I think that's an excellent point, right? We have the equivalent with running a lot, which is, it's the new year, people are going to start a training plan. And for the first 17 days in January, they go really, really hard, right? And then it's exhausting, it's not sustainable. And as coaches, we're always saying, no, like welcome to the walk run, like start with a walk run,
Yeah.
a couple times a week and build the foundation of the habit. And from the habit, you can do what you need to do. But I think the same applies to strength work as well. So I love that framing of it. Now, I'm sure as a surgeon at the hospital for special surgery, you see quite a few injuries come your way. So we do want to talk into this. We always like to pretend that, we're never going to get injured. But the truth is injury is something that does pop up as athletes. It's, active lives, busy bodies, especially with something like running, which is a single leg sport, which has a lot of overuse injuries that do crop up. What is your, what injuries do you see a lot of potentially with runners? And what's your advice for sort of either addressing these injuries or even preventatively keeping them at bay?
I think one injury that I see that's a little bit more of the easier one to treat would be IT band friction syndrome. Sometimes it's even called runner's knee. The athletes would come in and potentially they've trained a lot, or now I'm seeing a lot of college athletes who said, I was finishing up college now and I went out to run a half marathon and the outside of my knee really hurts. It's hard to go downstairs. It's hard to go down hills. A lot of the decline can cause pain with IT band friction syndrome. It's a lot of lateral sided pain of the knee, so on the outside of the knee. It can feel very sharp. It can feel like something significant is really wrong with the knee, but usually it's where it's an increase in training. One reason it happens more in women compared to men, or male athletes compared to female athletes, is that our hips are a little bit wider typically as women. And when you're looking at your hips going down to your knees, it's a little bit more of an angle. So the IT band has to be stretched out more. The IT band runs all the way from your glutes up to, your buttocks, all the way down to the outside of your knee. So it has a long way to travel. And if it gets tight, can actually aggravate both the outside of the hip and the outside of the knee. When I see these athletes come in, I'll talk to them. Usually, again, that tends to be the typical history. And we examine the knee and we talk about some things that they can avoid to prevent that, as well as how we treat it. For preventative measures for runner's knee or IT band friction syndrome, I usually recommend glute strengthening or abductor, abductor strengthening. And that can be as simple as getting one of those TheraBands or bands that stretch around your thighs, and you do a side-to-side walk. So you put the bands around your thighs and walk sideways both directions with the bands wrapped around your thighs or wrapped around your lower legs. And you really want to strengthen those abs, because that prevents the IT band from stretching as much as it does. The next thing would be IT band stretching. There's a lot of great IT band stretches out there. You can even look it up on the internet and it'll show you. And before you run, it's great to really get that IT band to be a little bit looser.
Yeah, I love when you talk about abductor stretching. And I used to have an anatomy professor who helped us remember abductor, AB, was running away from ab work. So your limb would move away from your body, like you want to move away from doing ab crunches or whatever it was. It was like a convoluted thing, but it's true. Like doing that abductor work is so important for just health. And that's one of the things I think that, when we think about injury prevention, strength work is sort of like, they go hand in hand, like they're almost dating when we think about this, because otherwise we are just moving forward in a straight line for a lot of our runs, and we're not getting any of that lateral motion, and we're not getting any of the benefit which can come inside strength work. Now, Karen, I wonder if you see anything else that comes up. I know in our chat, runners are like, yes, IT pain. That's like an old friend of mine. That's like one of the ones that like runners really identify with, because many of us do experience that over the course of our careers. Is there anything else that is it like a prevalent, maybe overuse injury that you see come through your door, and how would you recommend runners address it?
Unfortunately, one of the other ones we see are stress fractures or stress reactions. These can be a bit more serious than IT band friction syndrome, although IT band friction syndrome is very painful. Stress fractures sometimes can even require surgery, so it's really important we take those seriously. We see those presenting to our office usually with sharp pain in a specific area. Usually people can take their index finger and just point directly where they have the pain, and that signals us to think that potentially there could be a stress fracture or impending fracture that's going on in that area. For runners, we tend to see it in a couple different spots. One, there's certainly a lot of foot fractures or metatarsal fractures. The next one that you can think of would be around the hip region. You can get stress fractures of what's called the femoral neck, or that bone that makes up part of the hip. Another one too, we see tibia stress fractures, or that bone that's more of your shin bone. And all of those are really taken seriously. One, they're very painful, and two, again, the bone could fully break through and require surgery. When I see athletes with this, they usually get some imaging. We see it on X-ray, but sometimes we also have to look at MRI to evaluate it. If you do start to experience that pain, then we really want to have you restrict from running. To prevent it, there are ways to prevent stress fractures. And I think for women in particular, especially, as we get older, or even thinner women are more at risk for this, is osteoporosis or osteopenia. So what we want to do is make sure, especially in the New England area or areas where we don't get as much sun, we need vitamin D and calcium. Making sure that you appropriately get that in the diet. If you're lactose intolerant, you should potentially talk to your nutrition about it, as well as potentially a primary care doctor to make sure you're getting appropriate nutrition. The other thing that's really helpful to prevent stress fractures are certainly appropriate footwear. You want to track how long you're wearing your shoes. There are different apps that you can track how many miles you've put on your shoes, and make sure you're not wearing shoes that are really old and have lost their cushioning or lost their support. Also, sometimes we even advocate for inserts in your shoe to help your foot maintain its arch. And a lot of local running stores can really help you to be, one, fitted for the appropriate shoe, and then see if you do need an insert, that would help it too. Then finally, in terms of, we're talking about stress fractures around the hip, really watching your mileage. So just like you said, maybe having a run walk routine could be really helpful, but not just going out there and say, I'm going to go from 0 to 60 in 6 seconds. And I ran a mile yesterday, and then tomorrow I'm going to run 10 miles, and I'm just going to build up from there. It's really important to work with a running coach or your running group and make sure that you're on a very slow progression to increasing your miles, and don't shock the system. It can, just say, whoa, this is way too much for me. And it might start breaking down. Those are some critical factors. And then the strength training actually really helps. If we're thinking about preventing osteoporosis or osteopenia, it's really important to make sure you have that strength training as part of it too.
Yeah, I love this. You're like the person to talk to today about this, because it's like, here's what you might feel, here's how it's happening, and the truth is with stress fractures, it often means, as you said, being benched, right? In which we all do not want to do, but we have to allow ourselves to recover. There's stress fractures are one of those things that as runners, you quickly learn you cannot run through. You have to, as coaches, we always say, if you're feeling that that sharp pain, and just as you said, you can say like, it hurts right here, and it doesn't go away. Like you run 2 or 3 runs and it's not going away, and it's quite distracting and quite painful. It's one of those things that's like not going to quote unquote work itself out. I don't believe most injuries work themselves out, but this is one where it's really important to get it addressed sooner, because I ran collegiately. If you didn't get it addressed sooner, it was a season ending or a multiple season ending sort of thing, and you just had to sit on the sideline. So for a lot of our runners who maybe don't have teammates who have experienced that and can like highlight it, it's so important for us to do that self-evaluation of our bodies to say, pain and injury is just something that's not normal to the running experience. Like we've normalized it as a culture, but it really should be something that we address quickly, and we shouldn't be in pain for most of our runs. And I think that's, I'd love if you would just share a little bit of, sort of the things that you think that runners, let's go best practice, like what sort of things should runners be looking out for, and maybe just flag in their mind that they should get a follow-up either with a primary care physician or a sports medicine doctor? What are the sort of things that they should be thinking in their bodies, like, this is just not normal? And what would you hope that people come to you for?
I would hope that people would come to me for sharper pain that's just not going away. Running, as you're training and increasing your miles, you might be sore with time, so you can get muscle soreness. That's more of an aching feeling that goes away after you rest the muscles, or maybe you cross train, say take some time off to bike or swim, and see if you can control the pain by changing your activities or cross training. If you're running and then the pain just gets worse, it continues to get worse, it's pain at rest, pain when you're just trying to sleep at night, that's when we start worrying it might not be just muscle soreness. And then something could be going on with the bone, or just the IT band friction syndrome even may not be going away. So if it's something that's not going away, something that's persistent, something where the pain is starting to get up to a 4, 5, 6, you can pinpoint the pain, that's when you may want to present and talk to your doctor about it. And then just like you said, if you're noticing something, we all can be a little stubborn in our minds and say, I'm just going to run through it. I'm going to run through it. There may be a point at which we could have prevented that and changed you, and that you've been able to recover and get back to your race, get back to your training. So just kind of putting blinders on and I'm totally fine, I'm not injured at all, that's probably the bad way to go about doing it. But first talking to a medical provider or even your coach just to see if this is normal, I think that's really critical.
Yeah, I love that. We all love running, and it's fun. It's, sometimes we use it for, physical relaxation. We use it for sort of cleaning out some mental, cleaning out your mental garage at the end of the day or whatever it is, you're working on. But running through the pain is like foundationally just not a thing that we'll do. So like take a couple days off, see how you feel. And then really connect with people who do have expertise in the area, because you're right. If you can nip it in the bud now, you can have such a better season down the line. But as a runner, we've all lost seasons to stubbornness or just not knowledge of what was happening. And just having that self-awareness is like one of the things that every runner has to have in their toolbox, so they don't have to learn hard lessons, right? And listening to your body. And it's all like pains and aches, and addressing them if they're persistent is such an important thing. Well, let's get to some shout outs, because I know we've got some folks telling us what the good news is in the chat. So let's do some shout outs, and let's see if we have any questions too. So who do we have here? All right. Hello, Hassan. We're so happy that you're watching us. Thanks for joining us for our chat today. All right. Hi. Chang Billy says hi. Hello. Happy to, I know this is a frequent viewer, so it's good to see you. Thanks for joining us again. Sarah Katie says, hey, we got the hi, hello, and hey. So soon we're going to get like a bonjour in here as well. We always have really, Karen, we always have really great international viewers. So I wonder if we have any on the chat today. Sometimes folks are like, hello from Singapore. All right. Hi, native New Yorker, but in Maryland. I do love our New Yorkers because they're always like, native New Yorker, San Diego, right? Like the New York identity is so central to who we are that it's like, just want to claim it. I'm legit. And I'm like, I see you, Perry. I love it. All right. Who do we have? Who else do we have here? All right, Louis says, hi. Cool viewers. Thanks for tuning in today. We love everyone we have here. And hello from Amy. So thanks. All right. Do we have some questions in our chat? Perhaps we could get to one of those and see. Oh my gosh, it's gonna be real small. I'm gonna read. Here we go. I'm gonna get real close for our viewers. All right. So here we go. So the question is, as much as I'm eating so many different things to build up my energy, where it got punished for running 13.1 miles, do you know what is good to build up your energy after a long run, Jeffrey? So I'm going to reframe this question and say, we're talking about fueling and we're talking about post-run fueling. So Dr. Sutton, if you have any insight tips about post-run fueling, I'd let you go first and I could bring some energy to this question as well.
Post-run fueling. The good thing about post-run fueling is it is post-run. So that's very helpful to make sure that you've got your run under your belt. So sometimes you don't have to worry as much about any type of issues with the gastrointestinal system. So you've kind of gotten through that part. So you can have something a little bit more hearty. You can have something that potentially has some protein in it a bit. You can also have something that has electrolytes in it. You, during your run, probably have lost water. You've lost electrolytes. You've lost, in general, just generic calories. So carbohydrates are really helpful. And I think they do have certainly recovery drinks that you can get, but I would have a combination of certainly refueling with liquid. Sometimes it's difficult after a race to just have water because it sits in your stomach. And I find it's helpful to have something with a little bit of electrolytes in it. Some of the endurance drinks are great because it's not too sugary, but they have a nice balance of electrolytes in them. So something related to that. And then I do think it's helpful to get something of a bit more substance because you could have lost a bit of your calories during that time. And whether it's a little bit of protein, a little bit of carbohydrates, refueling that way is really important. And just don't drink it or don't eat it too fast because, again, your stomach, your bowels, everything's going to be a little bit cranky depending on how far you ran. And I think that just be aware of your system and what it can tolerate. Everybody's a little bit different, but everybody does need to refuel after their training or after a longer run.
Yeah, that the everyone is different is such like a truism. I think I love pro runners. I love following pro runners. I love, hearing what their training habits are. But even with pro runners, there's things that they can eat. And pro runner to pro runner, it changes, it differs. But everything is different for what they can intake, and the same for us as well, right? So finding what sits well in our stomachs if we're going for a long run and we need to take some sort of fuel along the course, that's going to be different person to person. It's going to be different person to person after a race, what we feel comfortable refueling up for. But you're right, that like combination of carbohydrates and proteins. And I always love for runners, I know this is really logistically challenging. If I were like, if I'm coaching my runners, I love to think of one thing that I really want them to do, to strive for, is in that 30-minute window right after they've finished running, to actually have some sort of protein or carbohydrate snack with them, some sort of fuel, especially for women's physiology. It's super beneficial during this time. Men have a little bit longer time to have some food to digest and get the benefit of that fuel that they're eating. Women have about 30 minutes of golden window time to really put something in their stomach. And we're talking like a snack. We're not talking like you need to sit down and have like Boston Market, right? I'm not having a whole like chicken dinner here. I'm saying, like, I want you to have something in your running bag. I want you to have something that you're eating along the way to fuel with. So runners, just make sure, especially to our women runners out there, 30 minutes is a really great golden window to refuel to get the benefit, but all runners can also benefit from that. So thanks for that question, Jeffrey. It's a great one. All right, so let us move on to our segment number 2. The Mastercard New York Mini 10K is upon us. This is a historical race for New York road runners and for women's running. It's a huge race. It was sort of revolutionary when it was happening. We continue to love and celebrate it. But let's talk a little bit about hydration just a little bit more, right? Because I think, Dr. Sutton, we had this thing happen that we had a half marathon where it was 70 degrees leading up to the half marathon, and then it spiked to 90, right? And so our bodies were not able to acclimatize, and a lot of runners just had to slow down the pace. We all were very, very hot on that day. And now we've had a little bit more time to be in the heat, but it's still the beginning, end of spring, beginning of summer. And so let's talk a little bit about just hydration, just generally, and what maybe the benefit of hydration is, and then what are some of the things that can happen if we're not properly hydrated going into race day.
One misconception with hydration is that you can do it all on race day. I think that's a real challenge. I think depending on the length of the race, you may want to start thinking about hydration even a week before. Hydration and sleep. Obviously, we could have a big talk on sleep too. But hydration, think of a week before. What can you tolerate? The day before the race, you probably want to make sure you're drinking an appropriate amount and potentially even electrolytes. Having that appropriate balance between water and electrolytes is really critical. You don't want to take race days just saying, well, I didn't do a lot yesterday, so I'm going to just drink a lot during the race. It's not going to be ingrained in your body at that time. You're not going to be ready to race if you come in from a dehydrated standpoint. So 1, before the race, you should make sure that you're appropriately hydrated. And 2, if the weather is changing, where we're going from all of your runs were at 50 degrees, which is one of the perfect times for runners in perfect weather temperature, to 80 to 90 degrees, your actually sweat is going to change. You won't be able to concentrate your sweat. You'll be sweating a little bit too much during that time. So you have to be more aware of that and do a few different things at stations. For example, when I'm running a marathon, if it does tend to be that type of a race, I will stop and go through most rest stops and get a water, a electrolyte drink, and potentially ice, and use that combination. You may need to put the water over your head. You might need to put the ice somewhere on your body, and then you may need an electrolyte and water drink. And take that extra time to. You don't always have to walk through that stop, but I think it's there for a reason. And if you can just take a moment to pause. And I feel like it's always important to finish a race with a smile. So as you're going through those water stops, really treat your body appropriately. And you may not feel like you need to drink a lot at that time, but you should be on top of it rather than trying to catch up. It's not going to work if you just try to hydrate your body. Once it's dehydrated, you're already kind of in the negative of that zone.
Yeah, that's, the idea that you can I call it cramming for a test. You can't cram hydration like you would for a test. Like it just doesn't work. It's the same with training. You can't go into the, I mean, it would be great. I'd love to be a camel secretly in another life. I'd be the best runner ever. But, you really just can't cram training. You can't be the week out being well, now I've got to really drop the hammer on my training. No, that's the week before is really the week to get the benefits. Yeah, you're all well, maybe just one more really hard workout. And you're actually, coach, your coach is going to tell you, please no, take that week easy so you can get all the adaptation and benefit from your training. And the same goes for hydration. You can't wake up race morning, although I've absolutely done it, and pretend that you're going to be really well hydrated because you had 2 bottles of water. What you're going to have to do is really pee and then try and find a porta potty, which is its own sort of race before a race that we've all also done. And you don't. That's another show. Another time is the errors in training that we've all done. So you're right. The week before, you've really got to be thinking, okay, I know the weather's going to be hot. Even if it's, mild, you can still really benefit from being well hydrated. Now, you did say something about sleep, and I'd love for you to unpack a little bit more about the benefits of sleep. And because I think it's one of those things that it's a pillar to training that we don't give enough attention to. We say fueling, hydration, strength work, injury prevention, and sleep's over here. Like, does anybody want to give me any attention? I'm foundational to success and athletic performance. Can you say a little bit more about why you think sleep is something that runners should be paying attention to?
One thing, yeah, I work with a coach as well, and he told me one time, because I'm always up on the latest. I'm like, oh, this recovery drink's awesome. I'm tracking my training with this app, and I have this watch, and I'm running with this backpack, and I've got all the tools and techniques, and these shoes are amazing. They're going to help me. And he and I have been to a few conferences where sleep, sleep is the best recovery tool that you have. It's one of the best performance tools that you have. I will say, do as I say and not as I do. I have 4 children, and I'm a surgeon, and I race both marathons and triathlons. And leading up to a race, if my body's aching, I will actually put in that effort, and I'll change my schedule so that I can get that sleep. I think it's critical. Your body repairs itself during sleep. Your body recovers itself during sleep, both from a mental standpoint as well as a physical standpoint. I can't emphasize it enough. And some people talk about tracking your sleep, and sometimes that stresses out people more. So find how you can get in that zone of sleep, sleeping well. To me, that's just as important as your nutrition, your strength and conditioning, and your training.
Yeah, I think as adults we all sort of say, well, this is it becomes less naturally. You start your sleep patterns change, and you have other priorities, right? That take all your attention. But sleep is absolutely one of those things that if I would rather my runners run 3 miles less on a training run and get more sleep than try and skip sleep. So it is really super powerful. And I know, we always say, like, the night before a race, nobody can sleep the night before a race. It is just like one of those things. You've got logistics. You want to get to the starting line. The races, they tend to be early, and you're tossing and turning. So as coaches, we emphasize the night before. So if, like, 2 nights out, you get a good night's sleep, 2 nights out, your body's going to be well prepped to do what you need to do. If you can't feel restful on the night of, you've got 1 night to go, it's okay. It happens to all of us. I don't think there's an Olympian alive who had a super restful sleep the night before their big race. So everyone has to deal with the anxiety of just getting to where they're going in the race performance. But as much as you can, as you said, Karen, really like banking sleep and trying to get that recovery when your body's able to really process and synthesize and really repair itself. We could just do a whole talk. She said we could do a whole talk on what it is to be really important with sleep. All right, so let's get a little bit to, before I break down, I'm going to break down some of the course, the mini course. We're going to do a quick deep dive. But runners, we still want your questions, still want your shout outs. Dr. Sutton is here to answer them with all her awesome expertise. All right, let's talk a little bit about supporting women's running. Super passionate about myself. I love to hear all about your marathons and triathlons. That's so cool. I'm going to ask you some of your favorite ways to support women athletes, because I know you work with so many of them, and just, really addressing the need for more media attention or whatever it is, that you think can bring more attention to the sport. I've got 3, and then I'm going to turn it over to you to give us some ways that you think we can support women athletes. So my 3 are: follow the runners on social media, right? We've got these amazing, in the US has amazing professional runners. They're all over social media. They're funny. Like, they're really funny and fun, and they've got great training tips, and they live the life of training, but they've also got, like, they write books. I'm just thinking of all these cool runners that I know that have a lot of energy and enthusiasm for things outside of running. But follow them on social media, learn who the runners are. The Mini 10K is an amazing pro field, which is why I'm also saying this. So my second tip is showing up to our events. We've got, like, what's going to happen at the Mini 10K is this phenomenal battle at the front of the race with these amazing women who are going for it. Just phenomenal athletes. So come, show up to the events, cheer. It means so much when you cheer, because women's running is a little less followed. As a New Yorker, if you stand on the side of Central Park and you cheer for a professional woman and you say her name, it's like a big deal. Like, I remember when I was running, I was like, they know my name? Like, I felt really hyped on it. It's not like LeBron James, right, who gets thousands of people. Like, you say a runner's name, it means a lot, and it really shows that you're a fan. And then my last one, is either, support women's running. If you're, if you're a running crew, if you identify as a woman and you want to be part of a crew, you can join a women's running crew socially, or you can find a woman coach. There's a lot of women coach out there, and you can support through working with a woman coach, having a woman surgeon, but also just like recognizing and tapping into the excellence of women's sports professionals who are all over and are just exceptional at what they do. So Karen, what do you think? What are your best ways and favorite ways to support women's athletics?
One of my favorite ways is if I'm in a race or my friends are watching me, I think you should be, again, smiling. I'm a big fan, smile during your race. And if you see somebody passing you or running ahead of you, I think my 18-year-old self will be like, I'm going to catch up with her. Like, how old is she? And am I going to beat her in my age bracket? Let's see what's on her for triathlons. We always see it on their leg. Like, is she, whatever age I am. And now it's the complete opposite. I'm so grateful to be out there being able to participate in races with, I'm 46. So being able to keep my body moving out there is really critical for me. And so I'll pass somebody. I'm like, you go get that medal. You go out there, get that medal. And I'll see somebody kind of struggling. You can physically see when somebody's struggling in a race and they want to give up. And I have supported my friends. They've supported me during some of these races when you're like, and so I'm just going to start walking. Like, what's the point? This is so silly. I mean, I will physically, hopefully we're moving out of the COVID time, but I will physically push somebody and I'm like, you got this. Like, you get your medal, you deserve this medal. And there's something empowering about running shoulder to shoulder with somebody that you just get in their rhythm, you get in their pace, you can feel it energize your body. And there have been some races I've run with women where I just say, hey, what time are you running? We're probably midway through the race and they say, I want to finish at that. I'm like, okay, do you mind if I kind of catch up with you? And I'll run with other women. Women tend to do better in groups. And I remember one race, it was the Quebec City Marathon, the Marathon des Deux Rives. And I was running with these two women. I'm like, you know what? I'm going to get a better time. I'm going to start running ahead. And as soon as I started running ahead, it was like a wall just came up and they were like, what'd you just do? You lost all your energy. What happened? So women do tend to be group athletes. And I think finding your group and sticking with them, whether it's your training group, your racing group, I think that can be really helpful. Two, kind of like you alluded to, I think finding a great running group. And again, I train with both women and men as training partners. And sometimes it's just nice to go with the women, whether you're talking about your periods, your kids. I remember trying to breastfeed and run after, having 4 kids. I'm like, well, this is not working too well. So just, you can talk about a lot of different things and things that you're going through. And then 3, support your local running shops. And a lot of times they are run by either current female runners or, former female runners, and kind of search it out, find a local running group. And I'm really a proponent of trying to buy locally and support your local running groups because they can find the best fit for you, the best insert for you. And I know oftentimes it's easy to just go on the internet and buy whatever's out there first, but it's a neighborhood and it's nice to have that neighborhood feeling. So try to find a running store that you're very respectful of the owner, you have seen what they've done for the community, and give back to them.
Yeah, we can get matching. We love running specialty stores anytime you want because I feel the same way. There's sources of knowledge about shoes. There's sources of knowledge about running groups, and they like live this running space, and they're just exceptional at it. So I love Run Specialty. And so like viewers, if you haven't had the experience of getting a pair of shoes fit by a Run Specialty shop, it like changes how you think about running shoes. And they'll talk you out of the ones of the nice color and they'll talk you into the ones that feel good. And that's what you need. It's like a coach for your running shoes. So I just want to second, I love all those. And just the power of like, somebody running past you and not being like, I got you, but being like, come with me, let's go. It's a very powerful thing when somebody's on your side for that. So those are, I love those all. Such good energy.
Just having that positive mindset is great.
Yeah, really. It's like impactful. And it's a memory that, I remember a lot of the races I've run where somebody's done that to me. I also remember races where somebody's tried to crush me. And sometimes that's cool. Sometimes we're going for something like big, but the times when someone's been like, get on, like someone will be like, Annick, this is the train, get on the train, which is like the running pack. Like that's always just tremendously helpful. All right, I know we've got some shout outs, we've got some questions. We're going to get to that. Runners, if you are running the mini 10K on Saturday, I've just got a few best practice tips, some things I want to let you know about. And it's two. There's two really big things I want to let you know about. All this information can be found on the website. But number one, the start of the race is on West 90th. So you're up in the 90s on Central Park. And so you want to, typically the race used to start in Columbus Circle. Now you are about 40 blocks north. So if you've run the race with us in the past and you're going to start heading over to Columbus Circle, keep walking north. You've got to get to that start. It is on 90th. So keep going up on the west side of the park and you'll find us there. You'll start to see it gets busy. You always know when the starting line's coming. We're like a big show. We have fun. So you'll see us when you get there. Come on up to 90th Street. And then the other thing is that the bag check, it always feels important to say, bag check is at the finish. It is not the start. So if you are bringing a bag on race day, make sure you head on over to the finish, which is south of the start, drop it off, and then come on up to 90th. So two things runners need to know about the start, slightly different this year. Otherwise, it is a gorgeous loop of Central Park. It's all the best parts of Central Park, not Harlem Hill. So all the best parts of Central Park, you go south on the west side, you go north on the east side, you cut over at the 102 transverse, and you don't have to do Harlem Hill. So I didn't design the course, but I'm going to say you're welcome, runners, because it'll be a great course, got all the fun, beautiful parts of the park, but you don't have that hike, which is Harlem Hill. All right, let's get to some questions because we got some great questions about to pop in here, and let's see what we can answer for our runners. All right. Hi, ladies. I sometimes get knee pain on my right, mainly in the part of my knee, the mid part of my knee, but it goes away when I'm resting. Is there anything I can do to prevent knee pain? What do you think, Karen?
I think one thing that you can do that we haven't touched on yet to prevent knee pain is a little exercise that it always sounds so silly when I tell my patients, but just straight leg raises. Keeping your quads really strong is really important, especially if you have any declines, if you're going down hills. The knees actually sometimes have to support 5 times your body weight as you're going down hills, and that can cause some of that knee pain. So doing straight leg raises, I tell people to maybe keep a 2 or 3 pound ankle weight in your nightstand or under a couch where you're watching TV at the end of the day, and doing 30 to 50 straight leg raises every day can be very, very useful. The knee likes to have muscles around it. So the knee obviously is taking a beating by our running and all the activities we do. It's constant pounding on the knee. But if you get the muscles engaged, it's almost like when you see a little tree sapling held up by the wires. The tree sapling can wobble back and forth and be completely unsupported. But once it has those wires up and it's trying to grow as a bigger tree, the wires act as your muscles. So it's trying to tell your knee where to go, how to move, and it can decrease some of the force and pressure experienced by your knee. So really trying to get those quads up. And gone are the days too where, for any of you who are current athletes or participated in athletes earlier in your career, those quad leg extension exercises, those will put too much stress on your knee. So if you're looking up quad strengthening exercises and go back to that old school, that leg extension machine, it could actually put too much pressure on your knee. So straight leg raises, protect the knee, yet engage the quads.
Yeah, I love that metaphor because it is a really powerful metaphor. And you think about all the times that your knee is asked to do things because of muscle weakness or imbalance. And the knee's not, like, it doesn't really want to do that much stabilizing. It wants to do its motion, it wants to support, but it's not meant to be a muscle. It's like a very complex joint. And sometimes it gets asked to do too much is when that's how I think of it. I'm like, you're asking the knee to do something that a muscle wants to do. So strengthening the muscles around the knee is so important. All right, we've got some great questions here. Who else do we have? All right, Tina's asking, I have very tight hip joints. What sort of stretches can I do to reduce the tightness? Karen, what do you think?
I may or may not be able to relate to that question. So I think one thing that's really helpful are the warrior poses in yoga. Very simple. Again, I don't like to overwhelm people with an hour worth of different exercises. But as you're brushing your teeth, I'll tell people just to do some of the warrior poses in the morning, and it really is going to stretch out your hip flexors. the hip flexors get really tight with, here you and I are sitting at our 90-degree angle with our hips, so everything getting contracted. You and I should probably be standing up right now, but it can help to just elongate the hips. And but those warrior poses are really good in yoga for stretching out the hips, and we're all prone to it as runners. And depending on what your career is too, if you're sitting for long periods of time, even consider getting a standing desk or walking around. If you're traveling to races, if you can have a day or two beforehand where you're walking around and getting stretched out again, because that's part of our lifestyle, is having tight hips with what we do. And I do think those warrior poses as you're brushing your teeth in the morning, or hopefully you have more time, is very helpful.
Yeah, the lifestyle component of tight hips is something that I think not a lot of us are aware of. But I remember when I transferred from professional running and coaching, and I got my first desk job, and I was never in more pain than when I sat for 6 months straight. And my body felt it, like my back got thrown out. I had like so many patterned injuries that happened because of it. And here I was, like, I could, go run endlessly. I could do really grueling workouts, but sitting was like the worst thing for me. And I had no concept of that until down the line when I started to realize, like, all the ways that, sitting is just so taxing to the hip flexors, as you said. It's killer. Next time we'll do this chat standing, or I don't know, we'll do it on the run or something.
That'd be fun. I'm in.
We'll do that one. Okay. All right. We got a great question coming up. I'm really excited for this one because it is women's health, and we're talking about women's health, and we have Dr. Sutton here. So let's get to this next one. All right. Hi, coaches. Hello. Any tips and recommendations regarding nutrition, medication, apparel for running while menstruating? I could do a whole chat about menstruating. I just love talking about things that we don't get to talk about a lot as women athletes. Attempting to fight fatigues or cramps. So we're talking about, recommendations generally, and I'd say any resources too that you know of where people can maybe learn more, and just getting a sense of what might help.
A few things running while menstruating. One thing to look for is whether you're using pads or tampons, or there are other reusable options too. But you want something that will stay in place. I know it sounds silly, but trying out things, the month before or I guess it would be a few months before your race, just so you have a couple cycles on board, but trying something out that feels comfortable. You don't want it to shift out of place or move around. The second thing is you can look at, for tampons in particular, you can look at the shape of them. They do have some sport tampons where they have the initial cotton aspect, but then there's something down below that actually helps to kind of prevent overflow for it. One thing that helps too is right before the race to get to the bathroom a little bit earlier, so you have a new pad, a new tampon, whatever you're using before the race, so you're starting a little bit fresh. And try not to forget that too, so the protection is not being overwhelmed. The next thing in terms of fighting fatigue during that time, we do not, gone are the days we thought we were losing a ton of blood, but although some people do with medical conditions, but just a regular period, we are losing some blood during that time. And throughout your month, you want to make sure that you have appropriate iron intake. Granted, iron can make you constipated, so don't just start a whole iron routine. I would advocate more to keep a lot of that in your diet. I think we do talk about supplements and adding things like vitamins and minerals to taking pills. But I think if you can look at your diet and see if you can incorporate a lot of this stuff into your diet, it'll be absorbed a lot better in your gut. Find ways that you can get protein and nutrition, whether you're vegetarian or you eat meat. I think it's really nice these days because I think we have a lot more options. I don't eat a lot of red meat or poultry, but we have more options to get protein and iron in our diet that way. In terms of medication, We always have to be careful with medication, so I don't want to say anything generically on this talk, but it's something where you can talk to your primary care doctor about it, because Advil and Motrin, if you're running a longer race, an endurance race, you're going to be slightly dehydrated, and it can put a little bit of added pressure on your stomach lining. So don't start that right before the race. Tylenol can be a little bit more tolerated, but Tylenol goes through your liver, so you want to make sure, obviously, that's appropriate too. Medication in general, I think, again, just if you do need some pain relief, find the one that works best with your body. But I think a constant being awareness of that we are women and that we could lose a little bit of iron and hemoglobin that produce some of the oxygenation to our body, but to keep that on a daily basis. It shouldn't be just the 3 to 5 days that you're menstruating. It should be the whole month where you're building up. Same as all the other things we talked about with food and hydration and sleep.
Yeah, I just think it's individualized to how how people experience their periods and the sort of symptoms they have. Like for me, whatever, how the hormones are working in my body, I get extreme back pain leading into the period, and then I'm completely fine. Like the week of, like I have completely different symptoms. And so if, tracking your period over time and noting symptoms along the way, when do you feel better? When do you feel worse? It wasn't until my coach, who was a woman, was like, hey, do you think your back pain's tied to your cycle? And I was like, no. Yes, it was, right? So sometimes you just even need to place over the feelings that you're having throughout the month and track it to your cycle and see if it's something that, maybe is triggered to your period and how you can mitigate symptoms, knowing they're going to come back, time over time. We have another great question that I'd love to get to because I think it is building off of this as well. So let's go and throw that up on the screen. We're going to go real small, so I'm going to read it out loud. All right. I'm curious about resources about performance and menstruation. There are plenty of articles I Google, but I pine for an expert source with whom I can ask questions. I'm not an elite runner, but very aggressive on the recreational scale, and I track so much that I'm hyper aware of the impact of hormones on performance throughout the month. And I want to push harder and stronger, but hormones are a pain. Smiley face. All right, Dr. Sutton, feelings about this, resources. I've got one up my sleeve that I sort of go to, but I'd love to know also how you think about answering this question.
Resources, obviously, this isn't my area of complete expertise, but at Hospital for Special Surgery, we do have a women's sports medicine group, and we're the first in the country, which is pretty cool. But Dr. Marcy Goolsby is somebody who helps us with that. She's a primary care sports medicine doctor and takes care of from weekend warriors to elite athletes and female athletes, and has done a lot of research in terms of the cycle and how it relates to our bone health. So I think seeing a primary care sports medicine doctor who has some background in female health and female athletes is really critical. And then I think one thing that we touched on earlier is keeping a journal and keeping track of everything, so that sometimes education is key. Oftentimes a patient will come in and for another specific injury, they'll come in for knee pain and they just want to know what it is. And when you know what it is, you know what to do. They don't necessarily need me to do surgery or intervene, but educating yourself about your own body is key. And during those times where maybe you're experiencing fatigue, maybe that week you want to get more sleep or you want to eat differently, get more protein. Protein is very helpful if we are feeling fatigued because it takes a little bit more time to process and it's released over time. So I think you're starting out really well by educating yourself about your body, but first understand your body and how you're tracking it with a journal, and then you can reach out to an expert to go over in more detail.
Yeah, I second Dr. Goolsby. I've spoken to her before. She's fantastic, great source of information. So I love that. Yeah, and it really is, there are folks, especially at the Hospital for Special Surgery, who are experts in this, right? And you do need an expert if you're talking about hormones. Hormones are a pain. They're also, part of the condition of runners.
Yeah.
Male, female, non-binary. I mean, we've all got hormones coursing through our systems at all times, and it, it's one of those things that I think we have to hack our own physiology to figure out what we need. And then, it can also be one of those strengths, because when you hack it and you figure out what you need to do to run an optimal performance, you can get so much faster, or it's one of those things that if you, as you are doing, Alexandra, like putting time, energy, and effort into it, there's benefits to it too. It's a lot of benefits to understanding your body's unique physiology and the hormone and what might be your specific cycle. One of the things that I love, and this is sort of if in addition to seeing a sports doctor and really understanding what's happening for you specifically, Dr. Stacy Sims has a book called Roar, which talks about strength work, and it talks about, and it's specifically for women's physiology, and it goes through the cycle, right? So it gives education around the cycle through the lens of a woman athlete. And it just got a lot of great information in there, just even from like what to eat for recovery at the end of a training run, how to think about hydration. It has a section, I believe, on pregnancy. And I believe Dr. Sims is putting out a book on menopause later, which we all are in desperate need of more information around how menopause impacts women athletes. But yeah, I think, Karen, this is just one of those topics that, like, as an athlete, it comes along with the, women are maybe given more, I want to say, like, because we have periods and it's such a visible reminder of hormones, we always feel like we're the ones who are having to really navigate it. But it also happens for everyone else too. They're also navigating hormone fluxes in their bodies. We're just, as women athletes, very aware of it.
We are.
Yeah, we are. And we all have to figure out how to make it work. All right. So we are coming to the end of our show. I'd love, Dr. Sutton, if you can give us one more, just like best piece of advice you'd have for women runners. Just, we're going general here. I'll give one too. My best piece of advice for those running this weekend would be to really tap into conversational pace if you're running for the first half of the race. And so by that, I mean, I really love for you to smile. We talked about smiling. And we don't mean that in the like, just go out there and have fun. Like, we mean go and like have deep personal satisfaction. And also when you smile, it sort of changes your body's positioning. Your shoulders go differently. Your mindset changes as well. So there's a lot about smiling during performance that can actually improve performance. And when I say conversational pace, I mean, don't go out like a bat out of hell. Hold back a little bit. And then over the course of those 6.2 miles, slowly pick up the pace and have a really strong finish. And that's when I smile. I always smile when I pace my race really well and I have a really big finish at my race. So that's my advice for our runners. How about you?
My advice would be along the same lines of smiling. I think it is important to really be able to end the race with a smile. So whatever your training program is, again, just make sure you're not overdoing it right at the start of the race. It's very easy. And I kind of laugh at it a little bit where a ton of people just go out really hard. And I'm like, you know what? I'm going to see you probably halfway through the race. So I'll just keep my pace and keep moving. And then the next thing that goes along with smiling is whatever number you want to pick, but 5 people, 10 people, I would say, great job. When I'm trying to catch up to somebody or somebody's struggling, just great job. You got this. And you'd be surprised how much energy it actually gives you to be able to do that. So if you're sending out positive energy to other people, actually, it will have the same positive effect on you. And you'll start feeling, happier during the race and more energized.
I love it. And that is a perfect place to end. Runners, thank you for joining us for HSS's Coaches Chat. Dr. Karen Sutton, thank you for joining us and sharing so much expertise on a random Wednesday. I love talking to you, and you've just been phenomenal. So thank you so much.
Thank you.
Yeah. Runners, run healthy, run happy, and we'll see you soon.